you can develop antibodies to blood that isn't as closely matched to your own blood type. And this is the reason why more black blood donors are needed, because for people with sickle cell in the black community, they need blood that is closer matched and safer for them.
Bespoke Minds Podcast, a place where we actively discuss mental health, self-care and healing, share stories to enhance our insight in an interactive way.
Hello and welcome to Bespoke Minds Podcast. I'm your host, Sickle, and in today's episode, we're going to have an open discussion about sickle cell. But before we get started, I'm going to introduce you to my lovely guests.
Hi everyone, my name is Nicole. I am Pharmacist Nicole on TikTok, and I discuss all things sickle cell and lifestyle. And and I also live with sickle cell.
And I'm Dr. Lewis Thomas. I provide sickle cell education via social media and run an online community called the Sickleverse to connect all the sickle cell warriors all over the world and share my medical insights.
That's amazing. You see here, we only bring you the best. So we have the best of the best here today. And we're going to have an amazing conversation, an amazing, much needed conversation. So, as you already know, we're going to start with an icebreaker game called Break the Ice. So it's a word association game. I'm going to say two opposite words and you just state your preference and tell me why. Sometimes it's random words as well, but it's just, state your preference and tell me why. So the first one is, do you prefer Uno or Monopoly?
Okay.
I'm going to say Monopoly, just because I think I like the strategic element and like the building, the kind of empire. I think Monopoly is a bit more my speed.
Okay.
I was second Dr. Lewis on that. Yeah, Monopoly for me too. Yeah.
I think growing up, I love Monopoly. I haven't played it in a while. I think it's about maybe 4 or 5 years. I haven't played it.
It's been a while.
But Uno, over Christmas, family dinners, they just bring out the cards.
It's very easy.
It's very easy as a simple. I'm just finding that I'm playing Uno a lot more. But I do love Monopoly, and I would get very competitive as well with it. So, Monopoly. So the next one is, do you prefer hot chocolate or iced tea?
Ooh.
Or neither?
I'm going to say hot chocolate. I think the thing with iced tea for me is that I don't like drinks that were meant to be hot in cold versions. So I only recently figured out that I like Baileys because I like it in hot chocolate, mixing it with hot chocolate.
I've never tried that. Oh, wow.
Beforehand though, I hated it because I just didn't like cold, milky, drinks that are meant to be hot.
Yeah, because although sometimes some people will be like, I've got one of my cousins, she loves Baileys, but she's like, ice. You have to have it with ice. You have to have it with ice. So, yeah. Me personally, I prefer hot chocolate. I love hot chocolate. I think that's my my guilty pleasure. In the past, where I've had to work in different places, sometimes that will be my pick me up in the morning, especially during the winter. I'll be like, right. On the office days, because luckily sometimes I get to work hybrid, won't get to work from home. But on the office days, when I have to wake up 6 in the morning, that's my motivation to get out of bed. So definitely hot chocolate. Although it's not good, my friends always telling me off. I know we've got a doctor here, so.
I mean, to be fair, if we're talking about sickle cell, hot drinks are better than cold drinks with ice.
Yeah.
So just put that.
I'm neither.
Okay.
Yeah, I'm not hot chocolate or an iced tea. I still am trying to grasp the concept of drinking chocolate.
Okay.
I only actually started eating chocolate at 14.
Oh, really?
Yeah, I only started eating it, and that was white chocolate. I still had to draw myself into milk chocolate, I think about 17, 18.
Okay, that was my next question I was going to ask. Chocolate.
And then iced tea, similar to Dr. Lewis, the concept of ice, I'm still trying to grasp. But so I'm just a tea babe, but that's what one of them say.
So no, I hear that. And you prefer tea? Traditional tea?
Ooh, Earl Grey.
Oh.
And I also like there is, M&S do that shortbread tea. This is like a shortbread tea. Please, this.
Okay, have to try it. Shortbread tea.
Shortbread
Not the biscuits, but the tea.
Yeah, it's a shortbread tea, and it has like a little taste of shortbread in it. So beautiful, so beautiful.
Is it very sweet?
It's not sweet, but you can taste like the biscuity sort of taste to it. There's like a biscuity taste to it. So yeah,
so I might go M&S on the way home.
Yeah, lovely.
You've inspired me there. No, definitely.
It's really good, really good.
And then next one, do you prefer hip hop or R&B?
Oh, that is a difficult one. Can we say both?
Yes, you can. Yes, you can. Sorry, I should have said that. You can say both.
There's an option for both. I would say both.
Yeah.
I'm a both. I love both R&B and hip hop. Yeah.
Definitely. Any favourite songs that come to mind at the moment?
Ew. What is...
Or favourite artists at all?
I think Chris Brown.
Okay.
I love Chris Brown.
He falls into kind of not really hip hop, but some people.
I think he's a mix.
Yeah, he's a mix. Isn't
yeah, he's a mix.
There's a lot of collaboration.
He does.
Yeah.
Can't go wrong with Chris Brown.
Can't go wrong. I think he's like, for me, like that one. Yeah. And then Drake. Is Drake? Would you class him as hip hop or R&B?
I always get confused.
Yeah.
I think he's both as well.
Yeah, both as well. Yeah. So yeah, that's why I'm a both babe.
But if I had to choose, I'd say R&B because I feel like R&B for me is like in every generation, like I could find good R&B, whereas with hip hop, I feel like I'm just tied to that like noughties where it was like Ja Rule and Ashanti just kept bringing out bangers like all the time, and that's kind of like my hip hop era.
Yeah.
But R&B, like I was listening to Masego Unhinged. What is it, off his new album on the way down here, and like that's my kind of vibe.
Yeah, no, definitely. I think for me as well, R&B. Like last night, I was on my Spotify R&B collection. I was like, oh my goodness, I haven't heard these in ages. So yeah, R&B. I love hip hop too.
Yeah.
I love hip hop. I think my introduction to hip hop was because I grew up with my uncle and my older brother, so it was by force. When they were playing loud music, I was, the DMX, Tupac, Busta Rhymes, all of them. So I was just, exposed to that. But I enjoyed it and I loved it.
What about Mariah Carey? Is she one in R&B?
I would put her in the R&B category, but I'm not
she's
sure
a big one for
if
me.
she's...
SWV. Yeah. These are the few girly ones.
Brandy, Monica.
Beautiful.
Yeah, I really like those soulful female R&B. Like I'm just one of them. I love
do
it.
you?
Yeah.
That's amazing. That's amazing. And then lastly for this segment, sorry, my laptop's closed. I don't know why I've done that. And then lastly for this segment, do you prefer the sun or the moon?
The sun.
The sun. Yeah.
The sun.
Me, it has to be sunshine.
Yeah.
Sun. Yeah. It just brightens the mood.
It does. Puts you in a good mood.
Makes you feel good.
Happy. And I'm guessing as well, it helps to prevent crises, or does it?
Oh, vitamin D.
Yeah, vitamin D. The warmth.
Mm-hmm.
Yeah. There's so many good things.
Oh, so many good
Right.
things. So many good things.
Definitely. Even for your mental health as well with the sunshine. You're like, ooh,
Yeah.
So that's amazing. So we're going to move on to the next section, which is called Moments of Truths, which is Have You Ever questions. So the first one is, have you ever forgotten a birthday or anniversary of somebody that you know and love?
I tend to be quite good with birthdays, actually. I tend to be quite good. I quickly put in my calendar.
I think I've never like completely forgotten. But there's, I don't think I'm pretty good as well, like with the calendar, like organized. I don't think I have actually, to be fair.
Yeah, no, likewise, I'm the same. I don't think I've forgotten. There's always a date in my head. I'm like, it's someone's birthday today, and then eventually I remember. Yeah. I'm really good with that too. So yeah, it's good to have organized people who remember stuff.
I have forgotten my own birthday.
Oh really?
But when again, not completely forgotten, but just kind of got through quite a big chunk of the day and just been, it's my birthday.
Yeah. Hopefully, I'm sure.
Were you
it
at the
ended with a
clinic?
Surprise.
Probably. It's like, oh yeah, it's my birthday.
Yeah.
I actually have a life.
Because I like to be off on my birthday.
Yeah.
I don't like to work. So I'm guessing in that instance, since you was on duty.
Yeah.
Yeah.
Yeah, when you're on duty, like that's all you can think about.
You didn't want to take the day off? Or did you not just like...
It probably was just during a day that was, I like to do stuff for my birthday on the weekend.
Okay, so yeah.
Have like
makes
a nice big weekend out of it rather than just one day.
Yeah, I hear you. And the next one, I'm looking at you, Doctor, but it's for everyone. Have you ever made somebody cry?
I've not made someone cry. I mean, yeah, I probably have when I was like a younger. But if you're talking about in the context of like doctor-patient, then no. Like I have been told that I have a very good bedside manner. So I think, okay, I'm remembering now. Like I've made someone cry with happiness and gratitude. And I think it was just based on being one of the first people that was like listening to her and taking her complaint seriously and helping her. So yeah, good happy
tears of joy.
Yeah,
no, that's amazing. Tears of joy is always good. Do you have any? Have you ever cried, Nicole?
Not right in front of me. I don't think I've come across that yet, and I hope I don't. I hope I don't make someone cry. If it's anything, it's joy. So,
even like a sibling or a family member. I'm sure I've made my siblings cry.
Okay, if it's like siblings, of course, like telling my sister off or like something along those lines, maybe. But it's not like I've upset them. They're just being like childish, rather than throwing tantrums.
No, likewise. I think in the same capacity as well. I think with my daughter, I probably made her cry a couple of times with the no or something. So,
exactly.
Yeah. So it's the norm, isn't it? I think it's like. It's all about the intention behind it, isn't it? Yeah. So yeah, we've got a good vibe here. I love this. And then lastly, the last question for this segment is, have you ever been a people pleaser?
Yeah.
Have you?
I have. Majority of my life I have been.
How did you come out of that cycle?
Ooh, being selfish. Like prioritizing myself. And I feel like it's natural being a people pleaser because I'm also an eldest daughter, and also me coming from a single parent household as well. My dad passing away when I was 15. I've had to, always making sure everyone's happy before myself. So that's where the people pleasing is. And then also because of my condition, sickle cell as well, I was bullied a lot, so that made me very self-conscious. So I'd always try and make up for things in other ways, just to like shadow my health as well. So yeah, I'd say I've been very much a people pleaser for a long time.
Oh yeah, but with me, it's all meaningful from what you've described as well. So
yeah, there is reasons for it, but yeah, now that I have a lot of self-love now. And self-respect, and I've been able to come out of that slowly but surely. But I think I still have tendencies, but for good reason, and for maybe like when I do want to provide showing love and providing support to other people. So yeah.
That's amazing. I think I'm known for being quite rebellious. With me, people pleasing not so much. I've always been one to kind of I'm not afraid to be alone. I'll just be by myself, or I'll do things that I want to do. And I think with time, then people will eventually understand and be like, oh, this is why you did what you wanted to do. I think out of all my siblings as well, I'm the most vocal too. So at home and growing up, now a lot of things have paid off for the good run by God's grace. But I've always been one to kind of not please people. I think my people pleasing is I serve to please God. Yeah. So my thing is, okay, I know that when it comes to judgment day, God will judge me. Yeah. Anybody else, and my parents. So as long as those individuals are fine, then.
Where are you within your siblings?
I'm just like you. I'm the eldest girl. Oh, okay. Yeah, so the second born child.
Oh, second born, okay.
Yeah. But my older brother, he's like left all the responsibilities to me. So sometimes I have to remind, hey, I'm not the older sibling, but he's got 6 children. So he's like, I'm busy and I'm done. He's like, I'm done. But yeah. So even within my parents and stuff, they started to become codependent. And I think, again, because of the profession, because of me being a social worker and the patience that I have and the skills that I have. So I think the rest of my siblings were feeding on that. But now they're learning how to really show up a lot more, which is really nice too.
That's useful.
Yeah. I had to tell them off a couple of times, but we're getting there now, which is nice. Because I don't live at home as well.
Yeah.
So I can't be the next of kin or the next person to follow. Yeah. Sorry.
Yeah, no, listening to you both it's reminding me a little bit of my mum. Who's kind of like the eldest daughter and has been known to be a people pleaser. But me, myself, I have always been quite independent. Like, I feel like for me, I've always cared more about my own opinion of myself and the things that I'm doing more than I care about other people's. So I still care about pleasing other people, but only if it aligns with what I feel is like right for me. So yeah, that's just always the kind of way I've been. I don't know why, and I don't know whether it's related to sickle cell and growing up in my family. I'm the oldest brother, but yeah, anyone will tell you that I just don't really care what other people think of it. So, yeah,
I think it's a good thing. It's good to have that balance, I guess. Because of our professions as well, we're not selfish people, we're quite selfless. So I think it's good that we have that autonomy, we're able to actually just be firm and say, no, actually.
I think it also comes from a place of like, I don't know if you've heard of like the Myers-Briggs personality tests, to come across that. So I'm like a INFJ, which is like introverted, intuitive, and like judging. But like part of it that resonates with me is that I feel like I believe very strongly in my own like sense of moral purpose and doing the right thing. And if that doesn't align with kind of society's what society deems as appropriate or acceptable, I don't care. I'm just going to continue to do it. And that kind of takes me to, being a doctor and working as a doctor and then leaving practice because that whole decision was based on me thinking, this is not right. I'm not doing what I'm here to do because this system is not set up in the right way.
And it's going against your personal ethics,
it's going against my personal morals and ethics. So, yeah.
Oh, well done to us. That's amazing. That's fantastic, honestly. And a lot of people struggle with people pleasing. And I guess sometimes, depending on who is on the receiving end on the other side as well, it can kind of change, isn't it? But ultimately, I'm glad that we're not. We're going to move on to the next section, which is called Care to Share, and it's a Did You Know? Did you know that there are currently around 12,000 to 15,000 people who have sickle cell disorder in England, according to the NICE guidance? And that statistic was taken from January 2025. So in case you don't know NICE, I'm sure we all know what NICE is. It's the National Institute to Health and Care Excellence. So that's a statistic that I found, which I think is quite interesting in terms of the figures.
I honestly thought it was higher.
I thought it was higher too.
Yeah.
Because interestingly, when I found that from NICE, they said that. But then when I looked at the Sickle Cell Society, they said it was about 18,000.
Yeah, that's more close to what I thought. Yeah.
And it's growing like every year.
And every year.
It is.
Yeah. So that's part of why I think in the NHS long-term plan, they want to improve sickle cell services because, there's been so much awareness and campaigns to sort of bring to light all the inadequacies and failures based on this being the most common genetic illness in the UK. 18,000 people suffering from it, but the investment doesn't tally up with that. So there's plans to so gradually correct things, but it's taken time.
Slow.
I mean, I was shocked when I saw the numbers, because even like what we know with A&E as well, and I've got family members, and I'm sure you've also got first-hand experiences of that too. So with that large number, how could we have the failings that we have? It's really unacceptable.
Especially knowing that other common conditions, common genetic conditions, have a lot more care and support in comparison to us. Like when you see the funds and the money that's going towards other common genetic conditions in comparison to sickle cell, so not much is being used in terms of sickle cell. It's literally a fraction, and it's so sad because we are, again, one of the most common genetic conditions in the UK.
I don't carry the trait, but I do have family members who do, and I have supported them within their care. And it's something that it's made me extremely passionate about, and also some of the clients that I care for as well, even when I come into contact with them in services and within the hospital and in the community as well. So it's something that we all collectively would like to raise more awareness about. But understandably, not everyone will understand what sickle cell is. So we have our lovely Dr. Lewis here, who is going to just tell us a bit more about sickle cell, the technical terms, and just give us some more insight and information about that.
Okay. Well, sickle cell is a genetic blood condition that's inherited in the genes from your parents. And the way that it affects the blood is by altering the shape of the red blood cells that carry oxygen through the blood to parts of the body. And the red blood cells are usually made of something called hemoglobin. That's what you might get checked if you have your blood test results. And in sickle cell, the hemoglobin is faulty. So hemoglobin is what actually binds to the oxygen. When people with sickle cell are exposed to low oxygen levels, for example, if you're at high altitude, or if you are exercising and overexerting yourself, the oxygen level drops. And what happens during that is the hemoglobin changes and sticks together inside the red blood cell. And this is actually what changes the shape of the sickle cell. So that's how that happens. But now we obviously have a sickle cell shaped red blood cell flowing through very narrow blood vessels in the body. And it's likely to get stuck and trapped, and they can stick together. And that essentially blocks off blood flow to parts of the body which need oxygen. So commonly this happens in the bones and the muscles and joints of the body. And that's termed a sickle cell crisis. So it creates this very severe pain, which is the medical term for it is ischemia. And ischemia is actually the same kind of pain you experience with a heart attack. So if you imagine the severity of a heart attack, that's what people with sickle cell experience when they have a sickle cell crisis. So lots of people have their own sort of ways of describing what it feels like. But something for me personally that I think it feels like is like being hit with a metal baseball bat. That's also like an electrocuted stun gun. So you have those two sensations at the same time. And what happens is your heart's pumping blood through your body constantly. So each time your heart beats, the blood is rushing up against the blockage in the blood vessels and preventing oxygen from getting where it needs to be. So it creates this kind of throbbing sensation in time with your heartbeat. So it's like it's just constant pain. It doesn't go away.
You answered my question. I was going to say, is it constant or does it?
Yeah, it's constant.
Wow. You said I had wow. And people go through this. And there's 18,000 people that live in the UK at present. Wow.
One of the main issues as well is that the pain is something that when you have sickle cell, you actually have to just cope with it. You have to get used to it. And a lot of the coping strategies that people use mean that they don't actually appear as though they're in pain. So they might look very calm and cool and collected, but still be suffering severe pain, because in order to, control the experience and not have an emotional breakdown, you have to remain calm. But then when you're in a hospital situation, the issue is that healthcare professionals don't understand sickle cell enough to appreciate the level of pain that they're suffering, because they just see people employing the coping strategies.
And they can't measure the pain, isn't it? So is there any pain management that's available at the moment, or in a situation like that? It's being...
So in that kind of situation where you're having a severe sickle cell crisis, the pain is at a level where you would require strong pain medication like morphine. Other opioids are used depending on the area of the world or hospital. But it's such severe pain that's the only thing that will actually help to make people feel more comfortable.
And is it effective when it's applied, or?
When it's applied at the right dose, it's effective. But this is another issue that unfortunately happens, because the doses that a lot of sickle cell patients require, because the pain is so bad, are often uncomfortable for healthcare professionals, because they're not used to giving such high dose of opioids or morphine to people who don't look like they're in pain to them from their perspective.
And I find that as well. I've seen it in the past as well, where someone will be on morphine and all of a sudden they're prescribed something else when they're still in pain as well. So that does make sense what you've just advised as well. Sorry, I'm taking all this information in as well. So it's very shocking as well. And also another thing I wasn't aware of is the sickle cell. When you said that the sickle cell all sticks together. So I had no idea. I just assumed that it was all transporting around the body and cell separately, but they all clog on together, and that's what causes a crisis. Is that correct?
Yeah, so it's kind of like one sickle cell will initially get stuck, and then it just blocks other cells from flowing past.
So it has like a domino effect.
Yeah.
It's like a traffic jam.
Yeah, no, honestly, you two are amazing, and all the warriors and everyone. I think it was really important to do this segment because, like I said before, the information is needed as well. And as I'm sitting here in the seat, I'm being educated as well, and I need to be well informed as well. What I think is brilliant as well is you are both advocating for change, and you're very both passionate about this as well. And also you do have a history of, not even a history, you have challenges as well. And it's something that this is your everyday, It's very easy for somebody to be an expert in something they don't know how to study it, but you have lived first-hand experience as well, which is just phenomenal. So I'm truly humbled just sitting here next to both of you and, being as a representative for the many and continuing to be the voice for the voiceless. So I really salute you and employ you. And it's even made me even more passionate to go ahead and to help to push that correct education. And I love that's something that you do, isn't it, on TikTok and on social media? And
yeah, so I think because sickle cell is so poorly understood by, I guess, the medical system because of the lack of investment in education, it's really important that people have enough education themselves so that they can advocate in situations where they might receive inappropriate treatment because healthcare professionals are ignorant of sickle cell in general, and they might not have received enough training on it. So because there's so much of the sickle cell experience is related to pain, and pain is something that just needs to be treated. Like, no one deserves to suffer pain, unnecessarily. And education is one way of feeling confident enough to advocate for yourself, to receive the correct treatment that prevents you from experiencing pain. So that's why I'm so passionate about it, because I know what that pain feels like. And yeah, I don't want anyone else to feel it when they don't have to. I've studied and trained so that I have a lot of knowledge, which means that I'm not experiencing pain as often as lots of people who don't have that. So now I'm just trying to make sure it's all shared so that other people, have the same tools that I have.
Because there's some triggers, isn't it? Like, I think like with weather, and sometimes it's like, I wouldn't say seasonal, but I think the weather is quite significant, isn't it?
Yeah.
And there's other factors that can trigger a crisis.
Yeah.
Is that correct?
Yes. There's so many triggers. Weather, so temperature, stress can also trigger. Infection can trigger. Those are a few that I know. Do you want to add to that, Dr. Lewis?
I guess dehydration as well. Do you say that?
Yeah.
So yeah, like when there is not enough water in the blood, it obviously means things can stick together a bit more.
Yeah.
So that's why we're all drinking.
Yeah, so some of these simple things, isn't it? You don't realise, well, I didn't realise that it can actually lead to a trigger. I know that we live in the UK as well, and we have the colder seasons, and we're currently in the cold season at the moment. So I'm guessing it presumes that it can cause more episodes.
Yes. Like growing up for me, a lot of my crisis in my childhood happened during the winter months because of the cold. Our bodies, our blood vessels, vasoconstrict, so they get tighter and narrower. So that makes it more likely for a crisis to come on. So yeah.
And what about, how are you in like the summer months in the sunshine?
We love it.
Oh, we love it.
That's why we love it. We love summer, heat. It opens up the blood vessels, so that again helps to support the sickle cells just to pass smoothly through. So that's why there's things like during the winter months, wear thicker clothing, and then an electric blanket is what we all recommend.
Okay.
So that, in bed, your blood vessels can open up and the sickle cells can move smoothly through the blood vessels. So a lot of those preventative strategies can really support sickle cell patients.
Yeah, no, definitely. And in terms of morphine as well, I know you've been a pharmacist. That's your area of expertise, which is amazing as well. Because I remember I went away with a friend once. We went on holiday, and she unfortunately had a crisis. And I think, and that's why one of the triggers that I was able to identify is the change of the weather. We went to a sunny place as well. But thankfully, she was in touch with her sickle cell nurse at the time, and she was given some morphine, but she had to be bed-bound as well. And I think from then, more of my friends, family, and people I know, when they're in crisis, morphine is really helpful, but they don't always get that as well. Yeah. So is it a prescribed drug?
Yes. So it's a prescription-only medicine, but also a controlled drug on top. So it's not just so easy just to retrieve it. You can't just get it on with emergency prescription, because it needs to be prescribed by your doctor. It's not the only controlled drug pain medicine. There's oxycodone, there's fentanyl, there's a lot of other pain medications that sickle cell patients can have access to. Because for me, morphine, I don't get along with it so great, especially Oromorph, the solution form. It can cause a lot of stomach upset. And I don't really like that. So I actually transitioned to oxycodone, which is another opioid similar level to morphine. So it is a difficult, pain medications within Sickle can be very difficult to access because of, how strong they are. But that just shows how significant the pain is in sickle cell. It is painful. It's a nasty pain, and just like Dr. Lewis said, the metal baseball bat is I think one of the best ways to put it. I think I also heard someone say that it's like shards of glass going through your blood vessels. Like, think about it in that format as well. So yeah,
it's very intense. That takes me back to labour. I mean, when I was in labour, I felt like I was being electrocuted. The way I could describe it was electrocution. Literally being... And
it's even good that we got into that, because last Sunday I spoke to my auntie at church. She also has sickle cell. And I was just... we got along really well because she has sickle cell, and she also has 3 kids. They're quite older, like they're at university now. And I actually asked her the question of, how was pregnancy for you, especially with 3 kids and sickle cell? And she says that sickle cell pain does not, or pregnancy pain, labor pain does not compare to sickle cell pain. It is worse than that. And even like nurses were shocked when she was having her children, that they're trying to give her painkillers. Like, oh, take it. And she's like, no, I don't want it. Like, I don't need it. She's like, but you literally just had a baby. You just had a baby. And she's like, sickle cell pain's worse than this. So you can only imagine. And apparently, I think pregnancy pain is the second most painful pain in the world. I don't know.
Oh, really?
I think it's second, and number 1 is being hit by a car. But if pregnancy pain is second, then sickle cell pain should be like even above that,
above that.
So
especially when it's ongoing, because labour comes and goes, and then you've the baby's ready to come out. But it's the crisis, you don't know. There's no time span as to how long you'll be in a crisis, isn't it?
I think it just goes to show that sickle cell patients are only asking for what they actually need. So, like, you've got someone in labour pain just not having any pain medication because she's saying she doesn't need it.
Exactly.
So it just goes to show that, like, in all of these situations where patients go to hospital, they are not there to just, waste their time. They're going because they need help. And I think it's massively, like, underestimated how much pain they're in.
Completely.
And it's very difficult unless you've actually felt it yourself to describe it and to describe the need for relief and just wanting to get out of that suffering. And I think I wanted to sort of briefly mention about sort of stigma and judgment, because it's a massive part of the sickle cell experience. When you're in that situation, a lot of people, it can look like drug seeking to healthcare professionals. I didn't say that because obviously we're healthcare professionals. We've seen it. I've seen drug seekers, and I know what that looks like. But I also know what sickle cell pain is. And for me, as a doctor, if I'm in a situation where, like, someone might be drug seeking, but I don't know, I'm just going to give them the medication, because if they're in pain, if sickle cell pain at the end of the day, I don't care whether they're drug seeking or not. Like, I think that it's unreasonable to withhold medication without knowing for sure that someone is not in pain. And sickle cell pain is something that you don't know unless you felt it.
The fact that you've said that as well, I was able to envision how it can come across and how that could look as well. And this is why it's very important as, again, healthcare practitioners, to just listen. Within our practice, we hear all the time, listen to the patient. I mean, you know, and this is where it comes, you know, the institutional racism and the systematic oppression and the favoritism and all of these things, but it just results in a negative experience as well. So, like, what could we do? How could we change this? Or, like, for instance, as a person who doesn't carry the sickle cell trait and I want to lift up my voice for change, how can I do that?
In terms of supporting the sickle cell community?
In terms of the question that I asked, how can I use my voice to support?
So from both a professional and personal perspective, number one would be donate blood. Donating blood is definitely especially within the Black community, we don't donate blood. A lot of us don't. I think the percentage is about maybe less than 10% of Black people donate blood in comparison to other ethnic minorities. So yeah, number one would be donate blood.
Can we go into the donating blood? In terms of the process, is it like when you go to your is it like having a standard blood test? What is the process? Because I think that sometimes some people don't understand the process of how easy it is to give blood. They think that maybe there's lots of forms that they have to fill out, or the needle injection alone can prevent a person from giving blood. So I think there is a lot of information, isn't it, that's out there to make it more accessible. And I know there is a campaign. That is many campaigns actually that is encouraging people to give blood.
Dr. Lucy, want to go?
Yeah, I mean the NHS blood transfusion, they've got the New Brixton Centre, and there's loads of promotion of that to get more Black people donating blood and to sort of tackle some of the misconceptions and beliefs about donating blood. I think like the core thing is that people aren't aware that they don't aware how important it is. They think someone else will do it, there is things like needle phobia and beliefs, religious beliefs somehow. But I think in terms of the religious beliefs, like there isn't any religion that actually forbids donating blood apart from like Jehovah's Witness. I think I'm not sure about that, but there's very few that actually do. I think with blood donation, it's just making sure that people know the reason why they need to donate blood. With sickle cell, if you're having lots of regular blood donations to keep you alive, you can develop antibodies to blood that isn't as closely matched to your own blood type. And this is the reason why more Black blood donors are needed, because for people with sickle cell in the Black community, they need blood that is closer matched and safer for them. Okay. So without going into too much detail, that's basically the reason.
So guys, we need to give blood. Like honestly, I've been moved and I didn't realize that something as simple as that. So I'm going to hold myself accountable and I am going to go and donate and give some blood.
That's good.
So I will do that because that's within my power.
Yeah,
although I don't like needles, but I'll get the job done. I think after childbirth, hey, you could do it. And from what you've advised, how the pain is a lot more, it's nothing compared to childbirth. So I will really be empowered to go and do that. And then I'll let you all know once I've done it.
Great.
So that's amazing. And is there anything else?
Other things to support, and I think providing gifting preventative strategies like electric blanket for one is an amazing tool to support sickle cell patients. Gifting electric blankets, even gifting if they're going through a lot, if they are having common crisis all the time, even gifting them supportive mechanisms. What else? can we say, even checking in as well. Sickle cell patients, we feel very lonely with this condition. It feels like we are alone. I'm coming from a family where I'm the only one with sickle cell. And, having someone maybe checking in and not just asking, oh, how are you? But like, how's your health? How are you doing? It makes us feel very, very loved, and we can become vulnerable with you. Sickle cell is like growing up with this condition. It's been really, really hard. I felt alone multiple times. I felt like I've had to fight battles personally and on my own. And, having, maybe someone that's checking in on me, asking how am I doing, how my health is and how I'm feeling, would be very, 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 very lovely. Very, very lovely. Yeah.
Yeah, no, that's amazing. Because it definitely takes a village as well. Because I've got like my friend, whenever she's gone quiet, I will check in on her and I'm like, is she? Then she'll be like, I'm in hospital. I'm not feeling very well,
Yeah. And
so whenever someone goes quiet, just check in on them, I would say.
Yeah, check in, or even take them to the hospital, like, be with them, be their companion as well. I really like watching TikToks of when friends come and visit, their friends who have sickle cell in hospital, or even, like, oh, do you need support in going to your blood transfusion? Do you need any food? Like, all of those things is definitely like,
it's practical support as well.
It's so beautiful, because again, like, this condition, it is tiresome. It's very tiring. It does take a lot from you, and that, empathy, that compassion that other people have in terms of thinking about you, it goes a long way.
So much amazing things about sickle cell, and I'm sure that you feel like the way I feel, where you've just learned a lot, and there's a lot of food for thought, and there's a lot to take away, and we can think about practical things that we could do to raise our voices as well, and just to make a difference. Giving blood is one of the significant ones, but I'm sure there's many more. If you're not able to, there's checking in, there's creating that village and creating that safe space for our loved ones and for people who are going through those who are going through a hard time and is in need of support in a crisis. So I would like us to go around and say like one final word or one final message or anything that you would like to contribute just to sum up for this amazing episode today. If you can think of anything, no pressure.
It's just kind of piggybacking off what you were saying previously about friends giving support. And it's basically to recognize the fact that sickle cell is an invisible illness, like it's invisible pain, and people are trying to appear normal, and it's hard in society to live like that. And anything that you can do, as a friend or family member, to make it easier for someone living with sickle cell to feel like they aren't abnormal or they aren't a burden is gonna really help them. So I just wanted to say that. I also wanted to say that it's really important for people not living with sickle cell to know their genotype, because just because you don't have sickle cell, just because you don't know anyone in your family that has sickle cell, you could still carry the gene for sickle cell, particularly people in the Black and ethnic minority communities. So this is now something that we want to get the awareness so that it just becomes the norm. Like, before you're considering having a baby, you should be aware of your genotype and you should know the chances of you having a child with sickle cell. Because in this day and age, it shouldn't be. There's too many people that are going into having babies without knowing, and it's such a massive thing to go through. And all it takes is just knowing your genotype and taking proportions.
Yeah, no, that's powerful. And I can see a movement because I know there's a few people that I know of as well who have actually, unfortunately, had to go their separate ways as well just because of that. So I feel like people are feel empowered to do that, but we need to continue to do that a lot more.
And actually, just to add to that, there is like a PGD where people with AS can actually do gene testing and they can actually conceive a child that is AS. So like there is a lot of support in that in terms of having a child with sickle cell in the UK at the moment. So they can take up on those strategies and things. Pain is part of the condition, but it doesn't define the entire experience. Like, as someone that has now been crisis free for a very long time now, I can say that as grateful as I am being crisis free, like there's more to just the pain. There's a lot more. Like we always talk about the pain part, but sickle cell affects everything. It affects your growth, puberty, your mental strength. So even like focusing on exams and daily focus, it affects everything. It's not just the pain, and I feel like it affects everything about someone's body with sickle cell, and I just feel like the pain is talked about, but there's a lot more happening behind the scenes. This is why we hear people going through maybe kidney failure or avascular necrosis and all sorts of issues with sickle cell over time, because it's a progressive condition. It is progressing because of just the continuous formation of abnormal red blood cells, and the body's not used to it. These organs, they're not used to the shape. Our body doesn't like the shape. So that's why it's so key when we donate blood, because it's not only just to reduce the pain and reduce crisis, but it's reducing significant complications that could develop over time, like retinopathy and all the others that I've mentioned earlier. So yeah, it doesn't define, pain is not the only thing that defines sickle cell. There is other things that make sickle cell such a don't you have a nice word to put, but just such a hard, difficult and nasty condition, which we can thank God that me and Dr. Lewis are in a good place, in a stable place right now. 100%. With our conditions right now.
And even with that being said, there's light at the end of the tunnel as well. So sometimes you could feel that there's no light at the end of the tunnel. And you two are both a shining example of that. Absolutely. And we're going to put all your details, and a lot more information for individuals who would like to know more about sickle cell as well, and where they can get some more help and information from.
So we've heard so much amazing things about sickle cell, and I'm sure that you feel like the way I feel, where you've just learned a lot, and there's a lot of food for thought, and there's a lot to take away, and we can think about practical things that we could do to raise our voices as well, and just to make a difference. Giving blood is one of the significant ones, but I'm sure there's many more. If you're not able to, there's checking in, there's creating that village and creating that safe space for our loved ones.
We come to the end of our episode, and I hope that you feel enriched with all the informative, the juicy, the real and insightful information that's been shared today.
Please continue to like, comment, share and subscribe, and I'll see you again.
Bye.
So my story was quite traumatizing, because obviously I think there were about maybe like 17 girls. I was one of the youngest. Everyone else was older. I don't know like how old the oldest was, and literally they just put all of us in one room.